Seth Feder, former healthcare professional and Gartner Analyst. Webinar Wednesday would like to thank today's sponsor, Ordr. Ordr is focused on making connected device security simple through zero-touch, agentless deployment, one common platform for multiple stakeholders, and automation of policies to secure devices. With Ordr, you will know exactly what's connected to the network in real time, all the time. You will know what's vulnerable, what's behaving maliciously, and why. You can then automate response for any connected device and enforce any networking and security infrastructure. Visit ordr.net, that's ORDR.net, for more information. Attendees, we have provided a couple of updates for you from the biomed and the HTM industry. They're located in the handout section of your webinar dashboard. These handouts can be downloaded to your computer or your mobile device, and they will provide information pertaining to the upcoming MD Expo in Houston, Texas, the HTM Mixer in Baltimore, applications for the 2023 class of this industry's 40 under 40, and TechNation's HTM Week contest. Again, if you'd like to download any of this information, do it at your convenience during the webinar by going to the handout section of your webinar dashboard. All right, as always, the webinar is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey. The survey will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive the CE certificate, and you will be able to download the certificate directly to your computer once submitted. If you have any questions along the way, certainly reach out to us at webinar@mdpublishing.com. Just a reminder, we're going to wrap up today's presentation with a live Q&A, so please submit your questions anytime using the question feature on your webinar dashboard. And as I mentioned earlier, our presenters today are Chris and Seth, and they'll be discussing how you can help protect against ransomware as an HTM professional. Chris and Seth, you may begin whenever you're ready.
Awesome. Thank you, Jamie. Thanks for the introduction, and welcome, Seth. I'm excited to go through these slides with you. And you know, as Jamie mentioned, we'd love questions along the way. We can take them probably at the end of the deck, but look forward to an interactive session. So we're going to cover on the agenda today the challenges of securing connected medical devices, which you live every day trying to keep your arms around not only securing but managing these devices. And why that's unique in healthcare, why it's unique for HTM specifically. We're going to talk about a maturity model or a way to think about how to approach improving security for connected medical devices. And then what is your role as an HTM or a bioengineering, whatever title you go by, what is your role in securing those connected medical devices? How do you contribute to that? And what other dependencies do you have? What tools can you leverage? What approaches should you consider? And then finally, what is HTM's role in optimizing security? Thinking about things from an organizational level, what role do you play at that level? What teams can you work with? What value do you bring to your organization with your unique perspective and your responsibility to protect those devices and ultimately protect patient safety? So I want to start off by talking a little bit about medical device risk, and I would assume that folks are on this call because you know that this is a growing challenge for organizations as they connect more devices to their network. More and more we're seeing healthcare devices or IoMT devices being connected. There's estimates that we'll see about 7.4 million IoMT devices deployed by 2026. That equates to about 3,800 per hospital. So depending on the size of your organization, you could be a little bit short of this or a lot bigger than this. We work with organizations that are in the tens of thousands, if not hundreds of thousands of connected devices across their environment. The other challenge is that there's a big variety. There's about 500,000 different types of IoMT devices today, so it's hard to kind of standardize on your approach to security. They all have different functions. They all impact patient services and safety in different ways, and they all have their unique, I would say, limitations when it comes to security. We're seeing that healthcare, as you probably know, is increasingly a target for attacks. About 88% of data breaches involve IOMT devices too. So these devices that are so critical to delivering services and ensuring patient safety and patient care are also very, very vulnerable, very in the crosshairs, if you will, of the adversaries. And when somebody targets a healthcare organization or an IOMT device, they're looking to deploy ransomware, exfiltrate data. They might use it as an entry point and a way to move laterally across your environment, move to other devices, other high-value targets. They might be deploying crypto mining or botnet software. So there's a lot of things that you need to really be concerned with. And we're gonna focus on primarily on ransomware, but categorically we want to protect your devices and your whole environment from any sort of adversary or any malicious attack or activity. And I would say these devices are dangerously vulnerable. Many lack proper security controls. Many have limitations. We'll talk about a few of those in the next slide. Limitations when it comes to security. And I know there's research that was put out recently that shows that about 75% of infusion pumps, just that category of device, 75% of them are running in operations with at least 2 vulnerabilities. So I think that's a testament to how prevalent the problem is and how difficult it is to secure these devices. And these are critical to patient care. You need to keep them in operations, but you need to think about how you can secure them and keep them protected.
Hey, Chris, since you mentioned exfiltrating data, there was a recent ransomware attack in the news just this week. Maybe it broke last week.
Yeah.
Pennsylvania healthcare provider
Right.
was ransomed, and the data that was exfiltrated was photographs, and it was a
Right.
cancer treatment center. And so it wasn't patient data, it was photographs, but it was quite embarrassing photographs for patients, and there's already been a lawsuit filed. So I'm just bringing that up. There's no data to say an IoT device was involved or to blame. I don't think that analysis has not been done yet. But this whole topic remains top of mind. It's just not going away. So I'm glad that you and I could be here today to try to help this community.
Yeah, definitely. I think unfortunately it's really a prevalent problem, not only in healthcare, but in other industries as well. But healthcare specifically, I think it's super urgent, super critical, since it does have patient safety and the safety of people at stake. We're not just talking about data, although the example you just gave has to do with data. But if a ransomware attack or even a botnet gets deployed on a device and impacts its ability to provide the services, that's not a good thing either. But what you mentioned will have impact to that organization, maybe financially, as far as reputation goes. So there's kind of a ripple effect with any sort of attack.
That's right.
All right. When you think about protecting these devices, they're quite unique. That class of IOMT device, these medical devices are very unique. They have some unique restrictions. We talk about that first bullet where you have limited discovery, management, and scanning capabilities. A lot of these devices, because of regulations, you can't just deploy an agent on them. So you don't have that option to put something on that has the ability to kind of keep an eye on what these devices are doing and what software is deployed and if they're patched and those sorts of things. You also can't scan a lot of them because you're concerned with impact to operations. So in many cases, you have kind of this black hole of these medical devices, and you're left to manual process of maintaining the current status, patch levels, and those sorts of things. A lot of these devices are running, outdated or legacy operating systems. They still have a lot of useful life left in them when it comes to the operations or delivering services, but they were built years ago and certified years ago based on operating systems that had a limited lifespan. So when these operating systems reach end of sale, you're kind of left with a dilemma of replacing those devices, which is expensive, or keeping them in operations. They're still offering services. In some cases, you cannot replace them. Maybe they're tied to a study. If you're an education institution in healthcare, maybe they're tied to a study, and you need to keep them around and on the network. So we need to look at ways to protect these devices that need to stay operational, but have kind of become obsolete from an operating system standpoint. And being obsolete at the OS level means that there are probably vulnerabilities that aren't being patched. And to that point, these devices are, when patches are available, it's not necessarily easy to apply those patches. You have to ensure you're not impacting services. You need to plan appropriately, around downtime. There may be a lot of these devices in your environment, and even identifying which ones need to be updated and prioritizing them can be very, very, very daunting. We talked about them not being properly secured or protected. Oftentimes, they might be deployed with default configurations, default passwords. They're not properly deployed on the network. They may not have some of the network level protections, things like we talk about segmentation or ways to limit communications on the network. Maybe some of those protections haven't been applied properly. And the thing to keep in mind is that any vulnerability, any vulnerable device on your network can really impact the safety of any other device in that environment, and ultimately the security of your organization as a whole, and at the core of that, the protection of patients, or ensuring that patient safety. And when we think about it, it's really a job, security in any organization is really a job of multiple teams. You as a device owner, you as an HTM are responsible for making sure these devices are available. You're maintaining them so that they're delivering services the way they should. You're also responsible for security. You have a lot on your plate. But you also need to think about what other teams in your organization, like on the security side, help to contribute to the security of these devices. There are other factors beyond just patching and upgrading operating systems and software. You need to think about things like how these devices are connected, what they're communicating with, and how to limit that exposure. And it's a great opportunity to work with your counterparts on the security side. So I think when you think about working with security, I would guess that a lot of folks on the phone may see that conversation as this picture. There's a big gap between what you do in your role and what security does in their role. There may be a gap between priorities, or maybe a gap between understanding, or what I talk about is kind of the language of what these two different teams talk about. There are a lot of barriers in your organization that may keep you from having a good, healthy relationship with security. But I think that's really required in order to provide what I'll say is a holistic security for these devices. So one of the things we want to talk about is not only in this talk, not only how you can improve your security practices, but also how you can improve relationships with your security team, so that you can provide more advanced protections, and also how you can provide more value to your organization and your security team with your unique perspective on the devices that you're responsible for.
Yeah, and when I was, because I was a clinical engineer, not an HTM, because we didn't have that word HTM.
Yeah.
This is 15 years ago, but so I was responsible for the PACS and some of the other medical device systems. And so I worked with the biomed. I was in IT, I was not security, though I was a biomedical engineer by training.
Yeah.
But we wanted a gap from the IT department, because that team wanted to come patch the computers and do things that the manufacturers didn't support. So like on the PACS system, for example, the PACS vendor didn't want us patching things and taking it to a different rev level than they had tested. So we wanted that gap to ensure the workflow for the radiology department was ensured. And so this is the push and pull the HTMs have to deal with.
Yeah.
And I think, given what you already outlined about the risks, we can't have that gap anymore. Like, we really need to close that gap.
Yeah, and I think having a healthy relationship between the two teams is super important, because security, to your point, security on one side sees the solution as being patching. HTM sees that as not being an option, but in reality there's a middle ground. There are other options that you can discuss to address that risk, right? And that's where I think HTM and security can come together, understand the priorities, understand the restrictions, understand the options, and apply the right approach. So it's really what we want to get to ultimately is having that collaboration so that we can improve security at the organizational level. So I'd like to do a little poll. So Jamie, if you can help us out with that, we want to know how closely you work with your security teams today, and if that's something you're doing. So Jamie.
Yeah, absolutely. Let me help you out, Chris. Attendees, we are going to launch a poll right now. You should be able to see it on your screen. As Chris stated, the question is, how closely do you work with your organization's information and security team? You'll see the answers there, or I do frequently, I do sometimes, but more collaboration is needed. I don't work with the IT security today, but would if asked, and I don't work with the security at all. While you are locking in your answers, just a reminder that if questions come to mind while you're watching the presentation today, you can use that question feature on your dashboard to send the question to our attention, and we'll save it to the end for the live Q&A. Looks like most of the audience has voted. I'll give you just a couple of more seconds if you want to lock in your answer.
Awesome. Seth,
all
do you want
right,
to
and I'm.
Which one's going to be the lead?
Yeah, I'm going to go with the safe bet's the middle ground. So I do sometimes, but more collaboration is needed. I think that's going to be the most popular.
All right, I'll be a little. I guess I just for a counter, I'll be a little bit more pessimistic and go for number 3 there. I don't work with IT security. What if I asked?
You know what? I love it. Both of you were close. One of you spot on. The other one got the second response. So let me go ahead and share the results with everyone. The attendees can now see that 28% say that they do frequently work with their IT security team. 34%, and the winning answer is I do sometimes. Then 21%, they say I do not, but would if asked. And 17% of the attendees today do not work with the security department at all. I'm going to go ahead and close us out of this. Chris, back over to you.
Awesome. Yeah, I'm happy to see that high percentage there on that top answer. A lot of people seem to have a good relationship. And I think our goal here is for everybody who answered is to help you improve that relationship. Even if you have a good working relationship, there's always room for doing more, adding more value across the team. So hopefully you walk away from with some items from this talk. Seth, you were going to say something?
That looks like optimistically that half the poll was saying they're doing some work, so that's good.
Yeah.
And to your point, looks like we could definitely help the other half and maybe even those who want more collaboration. So that's great.
Yep. Awesome. All right. Well, let's see if we let's get into it. So Seth, I know you and I are working on a paper around a maturity model for HTM. Do you want to talk a little bit about what that is and who it's for and how that would be used?
Sure. Yeah. So we wrote, or our writing, we're just about finished, is the security model. So it is for biomed engineers, HTMs, clinical engineers, to use when either while you're participating, if you're already participating with your organization's security strategy, or you desire to, and you want to know, how can I get more involved? This is for you. And if you're in that group that's not sure if you should or why you should, this guide will also make an argument why you should get involved. And the gist of it is that this team, HTMs, and by the way, when we say HTMs, we're inclusive, clinical engineering, biomed engineering. We know that you are on the front lines of care delivery, and you already help play a key role in helping the clinical workflow continue and keep the business humming. So therefore, you guys have a role to play in helping your security team make decisions and balancing risk with security protection, because that's really what it's all about. So we hope that that HTMs will use our guide and use this information today to engage with your organization and with the security strategy. Because I can tell you from my experience that your chief information security officer and your chief information officer, they really desire the whole organization to work with them. And so they would love it for you to knock on their door and introduce yourself if you happen to not know them, or just walk in and say, hey, I would like to get involved and hear some ideas, or start that conversation. So we hope that this guide helps you.
And here's the a visual of what we'll be talking about today. We're talking about 3 different areas of what I consider to be competency or practices, if you will. Part of the goal of the maturity model is to break things down into, I think, chunks that you can look at what needs to be done in each chunk. The idea is that this is not a linear thing. You don't master asset visibility and inventory and then move on to the next thing. The idea is that you get some momentum going in, maybe that first step, and then you're able to improve what you do from a vulnerability and risk management standpoint. But it's this kind of ongoing maturity of optimization and expanding your capabilities to do better and better, or to improve things, to optimize things. That third stage of optimized security is really thinking about how you can leverage more things to operationalize and expand and become more efficient at security. Part of that is also plugging into and improving that relationship with your security team. And ultimately, this all contributes to organizational goals. Here we have risk reduction. It's kind of an uber organizational goal, but this could be initiatives or other projects, major projects that are going on. So the goal is to help you contribute to contribute a voice to those projects in the with the goal of trying to reduce risk and improve security.
That's right. When you talk to your CISO, that's their job, is reducing risk. It's not solving security. It's not 100% security, because they know that's not achievable. It's reducing risk. So that's their approach, and that's the kind of language we'd encourage you to use.
Yep. Okay, so let's get into it. We're gonna cover each of those 3 categories and talk a little bit about what the goals are, how you would go about doing it, and then what the value is that you should expect from from each of these stages as you apply some of the actions. In the next slide, we'll talk about some of the actions you can take as an HTM, some of the things you want to start to think about doing. But in this first step, what we call asset visibility and inventory, the goal here is to eliminate any blind spots, to eliminate any unknown devices that are connected to your environment that you're responsible for, and provide a complete view of what we talk about as the attack surface. What are all those things that are out there connected to the network that could be vulnerable, that could be a target for an attack, that need to be known so that we can properly secure those things. So how do you do this? You're probably doing it today in some way, shape, or form. We talk to a lot of customers that are doing it. A lot of them are doing it manually, especially when it comes to IoT devices, because you can't scan them, you can't deploy agents on a lot of them. We'll see a customer example where they were, I say, running around with clipboards manually doing this, but I would assume your process isn't too far off today. It's not a very efficient way to do inventory. It's not a very accurate way to do inventory. So, and inventory is really foundational for anything that you do from a device management standpoint, as well as from a cybersecurity standpoint. So it's really important to get that as accurate as possible. And if we can leverage automation, I think hopefully it takes a big load off your shoulders, so you can do more strategic things, more interesting things with your job. So the idea with the how is to leverage tools that will automate discovery. We know we can't scan, we know we can't put agents on a lot of these devices. So looking at passive, or tools that use passive methods, and we'll talk a little bit more about that, passive methods to automatically discover. And the goal here is to have something that's continuous. So we're continually able to understand what's connected, understand that attack surface, even when a new device is added, when devices move around your organization. We want to make sure we have a current view. And then, if you're using an inventory tool like a CMMS or a CMDB, we want to go ahead and enrich that tool. We want to, let you leverage anything that you have existing. We just want to help you make that better and help to operationalize how you utilize those tools as well. The value, ultimately, we want to get you to that point where you can automate the discovery. So when a new device is added, almost instantly. We want to help you classify those devices. It's not enough to know that it's an MRI device or an infusion pump. It's important to know the make, the model, the class, the class of that device. That's important from a management standpoint. It's super important from a cybersecurity standpoint. So collecting that data, if we can do that automatically or as close to automatically as possible, that I would think is a big help. And as we look at that image on the right, these are the sorts of details that we would expect to collect. Everything from, the device information like the MAC address, serial numbers, manufacturer, to things like owner, who's responsible, who are you on the HTM team if we need to pick up the phone and call somebody if security sees an issue with the device, to information about where it is on the network. That helps you to understand. It would help security to understand what sorts of policies they need to create if they need to block ports in an attack, take quick action. It could even be helpful to you if you need to go find a device that maybe is a mobile device like an infusion pump that's getting moved around the organization. So a lot of rich information that could be added to your CMMS and CMDB tools. We want to help you maintain that automatically. So this should be a continuous process. And ultimately, we want you to see everything that's connected with as much detail as possible. So really the goal with this asset visibility and inventory step. So when we think about actions that you can take, the first thing would be to think about how you're doing it today and think about, can you identify a tool that will help you to do that automation or employ some automation? I would recommend looking for something that has passive capabilities. If you think about it, a network connected device cannot hide on the network. So if there are tools that allow you to analyze or will do the analysis for you, look at that network data to identify devices that are communicating on the network. It's a great way to automate this without having to scan or deploy agents that might impact services. Tools that do this, they passively ingest and analyze network data. They use what's called deep packet inspection to really deeply look at the information or the device communications. They use AI, artificial intelligence, and machine learning, and this is helpful to classify devices. Each of these devices or classes of devices have almost a unique fingerprint in the way that they communicate and operate within an organization. So that can go a long way as to automatically and very accurately identifying the device, again, which is important when it comes to security. So as you look at these tools, especially if you're looking at a tool that's integrating with the network, here's a point where you can start to collaborate with your security and probably networking teams to identify and define requirements. As we'll talk about, such a tool that's looking at the network that has this integration, this passive integration with the network, not only will benefit you from an asset inventory standpoint on the HTM side, but also could have some benefits on the security side as well. So that's why it's important, or can be important, to collaborate with your counterparts on the security team to make sure that you select a tool that can serve both audiences and ultimately can be a conduit for that collaboration. Once this is in place, you can start to automate your asset inventory. This is discovery of devices, classification, collection of data. Again, looking at network data can tell you a lot about that device, where it is on the network, how it's communicating. It can tell you levels of software or operating system. It can even give you some utilization information, which can be helpful as you're planning maintenance tasks, or as you're even looking at budget, if you're looking to add additional capacity to your environment. A tool that's looking at passively looking at the network also helps to establish a real-time view of your devices. So when a new device is connected, you automatically know. And one thing you'll want to do here is obviously, get a level of comfort with this tool, make sure that the way it's discovering and classifying devices is accurate. There may be opportunities to augment or enhance the data that's collected. Maybe some additional details can be added, but this should give you a jump start and hopefully take the burden of manual inventory off your shoulders. And then finally, you want to integrate, this tool and what it finds or discovers on your network. You want to integrate that with your CMMS and CMDB tools. So you want to enrich that central inventory tool with all the rich data and up-to-date information that you're able to find. And a lot of these tools have reconciliation capabilities, so you can ensure that there aren't things like duplicate entries. There's accuracy in data. There's a lot of things that you can leverage on that CMMS side to help to automate that enrichment process. I want to talk a little bit about a customer, an example of a customer that we've worked with. This is actually quite a big customer, and I'm sure a lot of folks on the phone are thinking, these numbers that we're going to talk about don't fit my organization. Maybe you're a little bit smaller, but think about this, that this approach has helped this customer at scale, in a very complex environment. It definitely is something that can help in smaller organizations as well. So this customer had hundreds of facilities, had hundreds of thousands of devices. They had security efforts that they defined as being manual. They said, in their words, haphazard, inefficient, reactive. They wanted to get better. They had limited insights when it came to devices, and they didn't know their risk ultimately because they didn't have an accurate view of their attack surface. At the start of their project, they happened to have 65 people, which included 12 HTMs, virtually running around with clipboards, performing inventory tasks, logging into devices to get details on operating system levels, patch levels, software levels. They had about 30,000 devices. They knew they had a ton more across their environments, and in their inventory, they were running at about 30 or 70% accuracy. So they leveraged a tool that was able to passively analyze network data, and that tool helped them to automate this process. It allowed them to ultimately, within 6 months, automatically discover without human interaction. They were able to discover 500,000 devices automatically, so quite a big scale. They were able to take that discovered information, those devices, and all the granular details about those devices, and enrich their CMMS and CMDB tools. They got up to about 99% accuracy in those inventory tools. And ultimately, they were able to get those HTMs back to more high-value tasks. So, away from the manual clipboard logging device information, which is tedious and error-prone, and got them back to something of much higher value, which I'm sure you'd rather be doing anything other than device inventory, which can be tedious. So once we have this inventory in place, or we have, we started to put that building block in place for automating how you're discovering and maintaining your device inventory, we've created a great foundation for vulnerability and risk management, being able to identify vulnerabilities and risk in your environment, and starting to think about how you operationalize and automate that, or make it more efficient, if you will. The goal here is to identify, assess, and address as many, if not all, the vulnerabilities and risk in your environment. You do that by leveraging that inventory we've established in step one. And you do that by leveraging a tool that can, hopefully the same tool that can not only inventory or discover those tools, or those devices, but also start to identify at-risk devices. These might be out-of-date operating systems. They might be end-of-life or recalled devices. They might be banned devices. We want to be able to identify as many of those as possible. A lot of these tools are going to inherently have some capabilities, but you can also enrich those if you're using things like threat feeds or recall databases, or other tools in your IT infrastructure that could provide insights about patch levels and software deployments. These are all opportunities to enrich your view of really of your attack surface and your vulnerabilities and risk. Ultimately, you want to secure at-risk devices, and we'll talk a little bit more about that. And really the value by using a tool, especially one that augments your inventory, is to provide you with a centralized view of all your vulnerabilities and risks, and give you a way to focus and really start to address those that are highest risk. So we've broken this down in 3 steps. First is to address at-risk devices. This would be end of support OSs, manufacturer, things that have been recalled. Maybe you learn from a manufacturer FDA list, banned devices, section 889 devices. The plan here would be to upgrade, replace, and retire as you can, but we know that that's not always it's not always an option. So what other options do you have? This is another great opportunity to work with your security team to talk about mitigations. How can I keep this device in operations? Maybe it's critical to our services. Maybe we have budget restrictions. How can I keep that in the environment but still keep it protected? This is a great opportunity to talk about those options with your security team, and we'll give you some insights there. Next is to update vulnerable devices. So patch OSs where you can, patch software, update configurations. A lot of these devices maybe are deployed with default configurations. This can include things like default or weak passwords. There's a lot of things that you can kind of do to clean house, if you will. And here's an opportunity also to think about how you might be able to leverage and plug into vulnerability management tools and different workflows that might already exist. How can you start to think about operationalizing this? If it comes to creating a ticket for somebody who needs to perform a task, either on the HTM team or across another team like security, how can you help to make that that process more efficient? So look to plug into those tools, and also look to how you can integrate your asset inventory and all the rich information that you've created in step 1. How can you use that information to enrich those tools and workflows? And again, for devices or assets or software that cannot be updated, you'll want to work with your security team to talk about mitigations. How can we apply something to protect this device until I can get to a patch or an upgrade, or until that patch or upgrade becomes available. And then finally, we want to take a look at device communications. We talked about how a device itself is vulnerable, either at the OS or software level, but the device is also vulnerable from a communication standpoint or from an environmental standpoint. What vulnerable or privileged protocols might it be using? Things like SMB or RDP would be considered to be privileged protocols that maybe shouldn't be enabled and shouldn't be used on certain devices, or should be limited. So we want to make sure we identify those and address those properly. We also want to look at how a device is connected on the network. If it's in the wrong VLAN, or if it's in the wrong network, connected to the wrong, if it's on the guest network, it should be on the corporate network or another restricted network. We want to identify those and work with security and networking teams to clean that up. And we also have an opportunity to look at how a device is communicating that might be risky. Maybe it has external communications and it shouldn't be talking to the internet, or maybe it's communicating with a known risky domain or known risky site. Maybe it's already talking to a command and control server that's connected to a potential ransomware attack. So we want to identify those early on and remediate that or fix that or address those potential vulnerabilities. And again, this is an opportunity to work with your security and networking team to address those.
Yeah, I'd say this is where HTMs can really add value here, because your IT teams, they can do a lot of this network analysis on their own. They don't need HTM to help them. What they do is it's the interpretation. They don't all they see is an IP address or a URL, and they don't know what that is for. But you are close to the workflow. You know that there is a vendor on the other end of the line, or there's a software update that's connected to that IP address, or there's a central server that's connected to the EHR as an interface. Like, you have all that knowledge, and that's where I think it's natural for HTMs to jump in here. After you've done what you're accustomed to doing on patching and updating, then you can really add value with the knowledge of what is actually going on here. Thanks, Chris.
That's a really good point. HTM brings that context that you need, that security needs to understand, what needs to be done, what the right thing is to do. It would be horrible if they turned off that connection that a device needs externally without knowing what the impact was to that device or the service.
Oh yeah, at my hospital, the CISO, his initial the initial remediation for any problem is shut the port off.
Yep.
Well, you can't do that because that could risk many things. So let's talk about a less blunt instrument.
Yeah, we have actually another customer example, not this one I'm going to talk about next, but in a few slides that I think is a good example of that, and how a team that has a good connection between HTM and security can do the right thing and make the right decisions by collaborating. But here's one with a customer that identified a vulnerable and forgotten device. They didn't even know it existed on the network. So they had unknown devices with unrealized exposure to external threats. The threat was, or the attacker was using a protocol that isn't typically blocked by default by a firewall. So it was something that is free to traverse that firewall from the outside inside. And the attacker was using methods to slowly scan. So other tools that would typically identify anomalous activity weren't able to do it. It was operating under the radar. So they, ultimately this organization was using a tool that was analyzing the network data. They were able to identify that a device, very subtly was communicating with a prohibited IP. So being able to integrate threat feed information, they knew that they had a list of prohibited IPs, and this happened to match one, so they were alerted. They dug a little bit deeper. They saw that the external communications were over port 445, which is used by Microsoft Active Directory and SMB to two very important but potentially vulnerable protocols, especially if exposed externally. And because they had their inventory in order, they had the device details in order, they had all the right context from the HTM team to understand what role this device played, where it was on the network, even where it was physically. They even had a picture of the device so they could go pinpoint it. They had that connection with the HTM team so they could help to address this this issue. And ultimately, they identified 2 Mindray medical workstations that were being targeted with this attack. And it happened that a vendor had stopped by years prior, about 4 years prior, had dropped these off as almost like demo machines and left them in the ER room. And they weren't logged, they weren't properly onboarded, they were unknown, connected to the corporate network, and very vulnerable. So they were able to avoid a bigger issue by using tools and by using the right insights and the right context to address the problem. So I want to cover this next slide. I know we're running a little tight on time, and I want to leave time for questions. But here's where we start to talk about optimizing security. So we're starting to build those building blocks of a good asset inventory, of good hygiene around device vulnerabilities and risk, and identifying and addressing that. Now we want to think about how can we get better, how can we make improvements. So the idea behind the maturity model is always looking for ways to optimize, expand, improve what you're doing so you have a bigger impact, hopefully with less effort. So here, optimize security efforts through risk-based prioritization. We'll talk a little bit about that, through automation techniques and through collaborating with your security team so you can solve bigger problems and prevent more complex, more sophisticated attacks. So we're expanding automation capabilities around inventory, around management, around security attacks. We're integrating more insights. There's opportunities to integrate more insights, not only from external sources like threat feeds and recall databases, but also across your IT infrastructure. There are other tools that have important insights or can provide important insights to know about your devices to enrich that view. Also look for ways to enrich the other tools, kind of outbound from HTM. What can I do to, in essence, share my knowledge, all the details that I've collected and context that I've collected about my devices? What can I do to enhance other tools and workflows to make things more efficient? And look for ways to provide your unique perspective and be part of that security conversation. If it's with your security counterpart, if it's with the larger management team, or even at the CISO level or organizational level, you have a very important perspective, and you provide a very important role in not only delivering services, but also ensuring patient safety and securing the overall organization. Value here is to improve efficiencies through automation. We want to continue to expand your view of device context and risk, And we want to help you operate more efficiently by prioritizing your efforts so you can identify and apply efforts to things that are going to have the most impact and that have the most risk. And then you hopefully be able to collaborate better, improve those relationships with security, and ultimately, everybody's happier, everybody's safer. So 3 things here to talk about. One is expanding and integrating the insights. This is both, if we're using a tool to do the automation for inventory and to do things like help us with vulnerability identification, vulnerability management, look for ways to enrich that tool with other sources of information to make it more valuable, and look for ways that it can sort of outbound enrich those other tools like we talked about. So there's a lot of opportunities for you to do that. Next is to understand clinical risk. And this is the device risk in the context of your organization. And if you think about device risk, it is a combination of a few different factors, and you as an HTM provide an important perspective on that, something that security can't do alone, especially to Seth's point, where security is kind of maybe operating in a vacuum and making decisions that are going to have impact that they don't realize. But you obviously bring that unique perspective of the device criticality to the table. You couple that with the view or the perspective of the environmental factors like network communications, something that security would bring to the table. But you also bring a very unique perspective of how critical this device is in your environment. What is the impact to patient safety should this device be compromised, or should we have to pull it offline in the event of an attack? So all these different factors get put together to calculate what we call clinical risk for this device. And you can, of course, use tools that will help you to automate the calculation of that risk. There's some customization that should be done to make that risk relevant in your environment, that organizational component relevant, so we can make that clinical risk relevant in your environment. And ultimately, we're using clinical risk to inform things like prioritization, inform things like response to an attack. How aggressively can I attack? How aggressively can I respond? How quickly can I respond? All of these things can benefit from understanding the clinical risk. And then finally, looking for ways to collaborate with security to protect against more advanced threats and to provide your unique perspective into things like device criticality, risk, security requirements, and be part of that security conversation. And ultimately, especially if you aspire to provide guidance at the organizational level and align more with some of these bigger initiatives. Maybe it's a bigger risk reduction initiative. Maybe it's something like zero trust, which you may hear a buzz about. There are things that are happening probably at the organizational and CISO level that you can be and should be a part of, because it impacts you and you have a very important perspective on the matter. Last customer example here. This one is accelerating response to ransomware. I think this is a great example of how HTM and security have come together to not only accelerate the response to a threat, but also take the right action or take the right steps to respond to that threat without impacting operations, without impacting patient safety. So their challenge initially was looking for a way to efficiently respond to threats, especially ransomware. And the security team luckily had an eye on operations and patient safety, and they were looking for a way to not only improve that response, but do it in such a way that they understood what the impact would be to their operations. So the solution was to use a tool that was able to identify compromised devices running obsolete operating systems, so they could clean up some of their vulnerabilities, partner with HTM to do things like patch and upgrade and apply mitigations or compensating controls, if you will, to protect devices that can't be patched and upgraded. They were able to use the tool that was looking at the network to recognize some anomalies, specifically some malware probes. This set off some alarms, so the incident response team became aware of the devices that were being probed in this instance. They had a lot of rich context that the HTM team was enriching the security tools with information about the device, exactly what the device was, the location on the network, a picture of the device, physical location, all the information security needs to do to understand what this thing is and how to take the next step. And this included that clinical risk rating. Another important component that was part of that device context was who is the HTM owner? And this was important because security ultimately picked up the phone and was able to include HTM as part of that incident response planning. From that, you get a lot more context of, if I need to pull the plug on this device, remove it from the network, what is the impact of this? If I can't do that, what other options do we have to protect this? What is ultimately the impact of patient safety? So working hand in hand in conjunction with HTM and security, they were able to formulate that right response and basically isolate this ransomware outbreak. They isolated, I think it was 5 machines in a matter of about 10 minutes. They were able to clean things up quite quickly and bring these devices back online with some compensating controls in place to protect it from being exploited or attacked further. Then they were able to contain that attack as well. So I think really a great example of tying together a lot of the concepts we covered.
And Chris, also in our on our guide that we're about to publish, in this stage, or as you operationalize, and our recommendation to HTMs is get involved in the governance, the security governance team. Like usually there's a committee that governs security. So it's convened by the CISO's office or maybe the CIO. The CISO is definitely going to be there. But this is where they convene a group of, as they call stakeholders from across the enterprise. What your concerns are, what are you seeing? It's like we, at this stage, as things are operationalized, this is where I think formally you can ask to be included in something like that. And I think the final point is we get to the step 3 to remember is like what I see is health systems are expanding well beyond the footprint of their physical campus. So ambulatory surgery centers, urgent care centers, satellite specialty clinics are being built and invested in, all over the country. So that just increases that threat surface area. So these steps that we're talking about make it more urgent to get involved.
Yep, definitely more urgent. And again, I think HTM can be a lot more strategic and should be part of this conversation because they have a lot at stake and they have a very important perspective and a lot of can provide a lot of important context to the security initiatives. I know we've got about 5 minutes left. I won't spend a lot of time on this, but I know Jamie mentioned that I'm from Ordr. We're a connected device security company. We help to do a lot of the things that we talked about in this presentation. One of the things that we do is automate that device discovery, classification, and gathering of details. We do that by analyzing network data. So we don't need agents. We don't need to scan. So we help you to establish that first step of asset inventory. We also help you to identify the devices that are vulnerable in your environment. We do that with a lot of native capabilities. We do that by enriching our view of the world with some of the external inputs that we talked about. And then ultimately, we help you secure those devices. We also provide this platform is a platform that serves not only HTM, but also security teams. So this is a tool that can be used to drive that collaboration or to enable that collaboration. And I think any collaboration between teams or any process is really a combination of tools and humans and people. So here's a great tool that can enable that collaboration and enable that centralized view of your environment and centralized view of your attack surface. And on the security side, we can do a lot to help security teams automate and optimize their response to something like ransomware, and also be more proactive about how they apply things like mitigations or compensating controls to proactively protect your environment. One slide I want to end on here, as Seth mentioned, we're working on a document around this webinar, around this topic, Healthcare Technology Manager's Guide for Implementing Connected Device Security. So keep an eye out for that. But if you want to learn more about Ordr and some of the things that we talked about, you can go to ordr.net/HTM, and we have a lot of great information there on that page and on our site. But I think with that, we have about 3 minutes left for questions. And hopefully
All right, Chris. Well, we did have a couple that came in during the presentation. I'm going to hold most of those and send them over to you after the webinar today, so you can follow up with the attendees directly. Let's get one question in. I had saved this one. Is asset inventory and assessment an ongoing task? And if so, how frequent should they be happening?
It's a really great question. Seth, do you want to take a stab at that, and I can add some of my perspective?
Yeah, thanks. As we tried to communicate earlier, that it's an ongoing process, so it happens. Those 3 steps we had in here, they're not done serially, they're done in parallel, and you're always looping back and repeating. So unfortunately, you're never finished with asset inventory and discovery, because the fact is your users are continually purchasing new equipment, and sometimes without your knowledge. What do you think, Chris?
Yeah, I would agree. I think it needs to be an ongoing thing. Environments are, the network is a dynamic animal, if you will. To your point, you have people that are attaching new devices every day, either sanctioned or unsanctioned, like the example we gave. So it's important that you have as close to real time, if not real time, a real time view of your environment. That way you can be alerted to any risk or vulnerabilities as quickly as possible. You want to be able to kind of triage that and address it as quickly as possible. So real time is super important.
Yeah, that's where the automation is really valuable, because having to do a manual inventory is no fun.
No, I'm sure most folks hate to think about endlessly walking around their environment performing that task manually. And even for tools that will scan or batch inventory, I don't think that's enough. It needs to be continuous. Everything is changing. New devices, patch levels, threats. It is a living, breathing organism, if you will, the connected device universe. So it needs to be real time.
All right, guys. Well, in the interest of time, since we've hit the 60-minute mark, I'm going to go ahead and wrap up today's webinar. I do want to give a big thank you to both of you, Chris and Seth, for your time. It was very informative. I do want to drive all attendees one last time to our sponsor today, Ordr. You'll see on your screen a specific URL that you could use to visit their website. That's ordr.net/HTM. Learn more about this company. And a quick reminder, you can obtain your CE certificate by completing the post-webinar survey. The survey is going to be emailed in 1 hour from right now. Once you receive that email, you'll be able to click the link, take your survey, and when it's submitted, you'll receive 1 CE credit. You'll be able to print your certificate from your computer. Along the way, if you have any questions or challenges, reach out to us here at webinar@mdpublishing.com. Of course, we're going to be back next week with another great webinar, so be sure to visit webinarwednesday.live for more details and an ongoing calendar. Make it a great day, and we'll see you back next week.
Thank you. Bye-bye.
Thank you.